It's not just about creating a stronger person, though, even functionally, even in the good ways that you use function. To have that patient or that individual out there who doesn't want to look like their mother or their grandmother all hunched over, we have to be specific about how we train ourselves to posture. You have a specific chapter on that. Give us a little bit of a flavor of what they'll find in that chapter.
Um, Somewhere I would say 2015, I started to pay attention to the thoracic spine much more than I've done in the past. So I did my diploma in '07, treated neck, treated lumbar spine, but then started to see, and I can't remember if it was in Scott Herbaui's course or Dave Oliver or Gary Dykes or one, or Dana Green or Robert Metcalf. I can't remember. Mark Miller, one of our great faculty members, said to me, don't neglect the thoracic spine. And sure enough, I remember, because after that I bought this IKEA bar stool for my wife. She was working, and eventually I sat on it one day, and I actually had my left shoulder was a little bothersome. And I sat on it and leaned back. Just leaned back, and I popped my thoracic spine. And I get up and I'm like, oh my God, my shoulder feels so much better. And I didn't do any cervical, no retraction, no extension, just. And then I started playing with the height of how much I scoot forward. And to be honest, Jason, since then I started to incorporate it much more into my cervical patient, and also even my hip patients benefited from it. So thoracic extension, I think, is something that on daily basis, and we did it as kids in school. We all leaned back in the chair and felt a pop, or didn't feel a pop, just felt good with it. And so that is one thing that I mentioned in the book, the importance of working on the thoracic spine, because the thoracic spine lives in kyphosis. And I also borrowed from McKenzie the slouch over correct, just gave it the 0 to 100%, just makes it easier for patients to understand if this is 0 and this is 100%, how to play around with changing their posture during the day, and the benefit. Like we discussed before, getting rid of creep, that's one thing. It allows your brain within 3 weeks to notice, and all my patients say that I'm now catching myself more. I get myself out of that end range if you practice this movement. And it allows the back muscles. I mean, it's such a ridiculous concept to say to someone, sit straight. Let your back muscles isometrically hold you without giving them a rest. It will never work. Just like a bicep curl. We don't curl and expect the bicep to grow. We curl and we rest. So the same thing applies here. So we gotta rest, we gotta load it. That's progressive. You can't tell someone go run a marathon. You gotta build endurance, you gotta slowly train for it. Rest and train and rest and train. Same thing with this. So you gotta rest, you gotta load it. If someone asks me how long does it take in general to achieve comfortable upright posture where I can sit on a bar, on a bar stool without slouching, it's about 3 months. And that's without lat pull down, seated row, reverse flies, Superman, TYI. I have done all these exercises that we learned in school, and my patient's posture didn't get better. But when I started to take MDT courses and I started to apply what I'm learning on myself, and I'm like, well, I don't have to be at 100%. I can be at 80. I'm comfortable here for 10 minutes, I'll go to 50%. Then I'll go back to 70%. I'll go down to 40%. When I learn that I can move in this direction and play around with it, it's not just black or white. There's a gray world here. And I call this, this is C world, for the letter C. C world, we see kids all the time now spending time here. And so parents, anyone that's listening to us, don't ask your kids to sit straight. Teach them the importance of recognizing 0 to 100% and move like so. When you're in class, you don't have to sit fully erect. Just move around with it, play with it, challenge yourself. use something to help you sit up.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.